Welcome to the Southwestern Endoscopy Center. Endoscopy, which means looking inside, is a vital tool in the evaluation of gastrointestinal problems and detection of colorectal cancer and precancerous polyps. Let's take a look at what to expect when you arrive for your appointment at SWEC. But before we do that, I'd like to introduce you to the SWGI mobile app, available both on iPhone and Android. This handy app will help you prepare for your appointment. Visit our website for more information at www.swgispecialists.com. SWEC is located in the same building with SWGI. It's just in the lower parking lot. Let me now introduce you to Patty, who will walk you through your appointment.
Hello, welcome to the Southwestern Endoscopy Center. My name is Patty Siemens and I'll be taking you on a quick tour of our facility, and you can see what to expect before, during, and after your procedure. Directly below me right here is the window where you will be registering for your procedure. You'll sign your name in, and then you may have a seat in our waiting area until your name is called so they can get you registered for your procedure. We have a room here, the door will be closed, and it is a very private registration process that we have here. We are ready for our next patient. We make the name and announcement by first name only because of the HIPAA requirements. So when the patients are ready, we escort them into the office here. They may come with family members if they'd like. We'd also like to remind you that you do need your insurance card and a form of identification before we start the registration process. We ask you your important demographic information, your social security number, your birth date. This is all private because it's done behind closed doors. And then we start to get your chart created here. Some of the information we've already obtained by the phone call. The rest of the information, such as how your bowel prep went yesterday or how well prepared you are for your examination, those questions will be asked here and also in the back when we're getting you ready for your procedure. When we are ready for you for your procedure, one of the nurses will come out and announce you by first name only, and we will take you in the back to get you ready for your procedure. If you'd like to follow me, I'll show you where we're going. As you come back in here, this is called our pre-admission and our recovery area. As patients become admitted, we have them step on the scale for their weight, and then we take them into a room for a private conversation. There's 10 rooms and they all look like this. We ask them questions about their preparation, if they are ready for the test, and then we have the patients change and get ready for their procedure here. We have a gown and a blanket and a little bag for everything, so everything is contained in one room. And this is we call this the pre-procedure room, and then post-operatively you will come here to wake up and recover. The total time for this procedure from the time you register to when you go home is approximately 2 to 3 hours, and this may vary also. When you come into the room, once you've got yourself changed and settled into the bed, we get your blood pressure and vital signs, and then we start an IV on you, which is an intravenous fluid that just has lactated ringers, which is a water-like substance to keep the veins open until your procedure is ready to start. And you sit here and you can wait with your family members. The doctor does come in and talk to you before the procedure. We have an anesthesia doctor that will also interview you before the procedure, and the staff that will take care of you in the room comes in to meet you before you go back for your procedure. When the doctor's ready to perform your procedure, this is the room you will be coming to. The bed is located here. The doctor will be standing right here with his scope, and this is the computer where the scope is attached to, and this is where they get all their visualization during the procedure. It will show on a TV screen monitor up on the wall. The anesthesia station is located in this area. The medications and everything they will need to keep you sedated are located in this little cabinet. The time spent in this room is anywhere from 15 to 30 minutes, sometimes shorter, sometimes a little longer, depending on what procedure the doctor is doing. Okay. And they'll bring your bed back out here, and once you're here, we will again hook you up to monitors. So you will have a blood pressure cuff on, pulse ox, and sometimes people will have a little bit of oxygen in their nose when they first wake up. This is all routine for all post-procedure patients, and it stays on for about 5 or 10 minutes. And at that time, you start to wake up, and once you're awake, we'll give you something to drink, and the doctor will come in and talk to you before you leave after your procedure. Usually within 30 minutes, it's a minimum stay it's required with the anesthesia that you have. Now, patients are discharged from here, but they will not be allowed to drive a motor vehicle for 24 hours. Family members are welcome to come back in and sit with you again as soon as you start to wake up. They can be here when the doctor talks to you if you choose to have them with you. A nurse will come in and get your final blood pressure and take your IV out. After the IV is removed, you're allowed to put your clothes on and get ready to leave. At this time, family members are welcome to go out and get the car, which is in the parking lot, which is also a lot of plenty of free parking for patients. And once the patient has changed, we escort them back out through the waiting area and the main entrance and to their car doors whenever they're ready for discharge.